as the Programs Officer, Gender Mainstreaming and Inclusion. And today, I would be driving the conversation for this breakout session. Okay, so today, how many of you have heard about care work and you're interested in knowing more about it? Let me know how many people are a member of our team. We have new converts. Let me see your hands up. Okay. Oh, we have new converts. That's good. Please appreciate yourself, new converts. If you're a new convert, appreciate yourselves. Okay. All right. So today's conversation is easing the burden, what works for recognition, reduction, and redistribution of unpaid care work. And as I earlier said, I know that a lot of us do not have knowledge or are not conversant to this particular terminology or this particular approach. Just to give a little context, I'm very sure that in our everyday life, we know that women give at least 90% of care to cooking, cleaning, washing, taking care of the elderly. Everything that has to do with nurturing is done by women. And according to data, this work is approximately 249 minutes per day women give into care work. And in comparison to men, it's about 89 minutes per day. That's alarming, right? Isn't that alarming? That's alarming. And we want to see how we can put more value to care. We want to see how more women would be able to benefit from nurturing and caring. That way, they'll be economically empowered. That way, they'll be valued. And that way, they can also contribute meaningfully to the society. Which is why today, I have very wonderful, distinguished, and intelligent experts who will be joining me on this conversation today. And without wasting more time, let me invite them. And please, when I call their name, please, I need to give a resounding round of applause as I invite them to the stage. All right, first, we have Mrs. Grace Obi Opabi from the Federal Ministry of Budget and Economic Planning. Please, if you're here, please can you make your way up? All right, while we wait for Mrs. Grace, we have Ada Osamede Udechukwu from International Finance Corporation. Please, if you're here, can you join us? She's okay. Also, we have Dr. Runo Onosode from International Labour Organization. Is she here? And please join me, welcome Dr. M.M. Omokaro she's the Executive Chair, the Dave Omokaro Foundation. And lastly, from the National Bureau of Statistics, join me, welcome Caroline Fatuoti, the Head Gender and Social Inclusion. Please, this round of applause is not encouraging. Do you want me to tell them to go back? Encourage us. Thank you. Thank you very much, ma'am, for joining us. Okay, just to give a little house rule, I will be in your ears for the next 40 minutes. Don't get tired. You enjoy the conversation. And in the course of the conversation, we're going to give time for you to ask us questions. So please, if you have any question, ensure that you write it down and you direct it to the panel member. Okay. Also, to my panel members, for every questions we give, please let's make it brief so that we can be on time. Okay. Now let's dive into the conversation. My first question is directed to Mrs. Grace Obi Ukpabi from Ministry of Budget and Economic Planning. My question is, Nigeria is currently considering a national care policy. What steps are the government taking to institutionalize care within national planning and budget, its framework, and how can states support to also align and implement this policy effectively. So we want to understand what are the works and how would states also implement this policy if adopted.
Thank you very much, moderator. Good afternoon, ladies and gentlemen. Like she said, my name is Grace Obiukabi. I'm the Director of Social Development in the Ministry of Budget and Economic Planning. The work of my ministry is actually to develop cross-cutting policy. The care economy policy falls within the cross-cutting policy because care economy cuts across the economic sectors and the social sectors. It cuts across both youth, it cuts across elderly, it cuts across women. So we are in the process of concluding the development of the care economy policy, because we find out that most work that is done that we refer to as unpaid care work actually has economic benefits, but because we don't document and we don't have evidence, we treat issues of economic policy under unpaid care work as a pro bono job that you do that has no monetary reward. And the danger is that when government calculates what brings income to the country, they seem to drop the issue of care economy because they can't put an amount to it. Having a policy will give kind of an institution for it, a name, a formalization to the care economy. Around Nigeria, people in Nigeria don't take care economy as a work. We take it as a part-time, pending when I'll get a job. But you leave Nigeria to somewhere like Ghana, you see people taking it as an income, a paid job. And you go further to Europe and developed country, it becomes a money-spinning career for families. But here in Nigeria, we don't seem to value it because there's no formalization of care work. People hide, people are ashamed that they do care work. But actually, care work, if you look at it, is the foundation of every economy. If you don't have people taking care of the home front, 100% of those that go to work can't go to work. They will do the homework before going to work and they won't meet up. You need the care part of the economy to have the productive side of the economy, because somebody has to wash your clothes, clean your house, cook your food, put your things in order. That's for those that work. For children, because we say care work is a life cycle work. If a child does not have the kind of nutrient he deserves as a child, he will grow up an adult that is not using his full potential for the benefits of the economy. So if mothers sit at home, give their children the basic nutrient they need in food, from breast milk to proper meal, give them some basic characteristics that makes them very productive in society. When they become adults, that's where we have people like you in this room, people that end up becoming president, governors, senators, because somebody did the work when they're a child. And that work that was done when they were children is called care economy, care unpaid care work. Nobody pays the mother to carry a baby in the womb. Nobody pays the mother to breastfeed her, the child. Nobody pays her to clean and change the nappies. So we want to formalize that work. We're not formalizing it to get a monetary reward for mothers. We are formalizing it to have an economic calculation of what they put into the economy. The policy that Ministry of Budget and Economic Planning is developing, therefore, is to say, when you do your chart of accounts, standard chart of accounts, and you begin to take record of what brings income to the economy, please include the unpaid care work. Even though theirs are not tangible as a monetary value, the work can be converted and calculated. And that is where the work that MBS is doing comes to play. The time use survey will be able to calculate how much, and then if we convert it to the basic, that is our minimum wage, then how much should somebody that works 4 or 5 hours a day be paid? And you begin to put an amount to it. That policy is on the way. We have it in 2023 budget Don't ask me the amount. But for you to have a budget line in Nigeria called unpaid care work is a celebration. Because to get a budget line in Nigeria takes a lot of lobbying. It might not be money much, but it shows the government now knows what care economy is all about. And that is an achievement for us. For the states, last month, through the help of UN Women and some partners, we're in Cross River State. If you're from Cross River here, stand up, wave proudly. Thank you. Cross Riverians and Akwa Iboms happen to be the best caregivers in Nigeria. Don't argue about it. So if you have them as your caregiver, you're sure of some basic thing: neatness, honesty, clean work. It's not something to be ashamed of. It's one of the most exported profession in Nigeria right now, the care work. So we want to formalize it by helping the state build capacity of caregivers, so that you know how not to put yourself at risk as a caregiver. You know how to price yourself as a caregiver. You know how to carry yourself as a caregiver, as a professional. We're working with Cross River. We want to extend to Lagos State. Actually, we want to do at least a state geopolitical zone. But it's the resources. But we're starting somewhere. We're talking to ILO because they are in charge of labor. Care economy should be put in the standard chart of labor force in Nigeria. We are talking to UN Women. Women are more in the unpaid care work than men. We are talking to Ministry of Women Affairs, and of course internally we are talking to the budget office that has the budget line. In the national planning, we are reviewing the National Development Plan 2021 to 2025 is expiring this year. It's the right time to begin to talk to internally. For 2026 National Development Plan, we want to see, if not a full chapter, a sub-chapter under the human capital chapter talking about care economy. And that is how we want to institutionalize care pay and then cascade to state. What we can't do at the federal, we might never be able to enforce at state level. And you know, the federal develops policy. The people that implement actually the state. Every citizen here belongs to a state. There's no citizen that is a federal citizen. So we develop and then we act. We support states to adapt and then cascade as it may. Thank you.
Thank you very much for that response. And you will agree with me that most of the japa that you've been seeing in Nigeria is what? Is what? Is not is what? So you see, we too, we need to institutionalize it so that at least the japa syndrome will reduce to an extent. Right? Right. All right. So my next question, thank you very much, Ma, for that submissions. So my next question is directed to Dr. Emen Omakaro. With Nigerian aging population, I'm very much interested in this particular question. Care of the elderly is more urgent. And how can Nigerian design and implement systems of care that responds to the need of senior citizens while also reducing the unpaid burden placed on women in families?
Thank you very much for, first, the organizers for inviting me. And I'm sure that not a few people here have older parents. And I'm sure a good percentage of you are taking care of those parents. And also a good percentage of you are conflicted between your work time and the care time. For a long time, it had been the African family model. Children are there, children must care for their parents. We see what urbanization and migration has done. We see how our communities are being emptied of the caregivers. And the thing is that the population of older persons is rapidly increasing. Yes, it's a youthful country, but now we have about 14.8 million older people. And from disaggregated data from MBS, about 2.1 million of the 14 million have self-care challenge. They can hardly take care of activities of daily living. And so what we find presently is that people just do what they can do, not necessarily doing what is good to do, what is the best practice. And so we have persons who open up care agencies here and there. And we have older adults who once in a while run in to see their parents. And then we have older persons being left in the care of minors. And this really leads to abuse. There's increasing incidents of abuse of our older persons. So I want to answer that question from my lived experience of what I did as the Director General of the National Senior Citizen Center. I was the pioneer Director General. And the National Senior Citizen Center was set up by the National Senior Citizen Center Act. I'm particularly naming this act so that we see what legislation can do, the compelling force of legislation. And then, of course, we identify the need, and the need is a growing need for long-term care. But the question will be that this policy, which, of course, captured this need, has to be operationalized. So we now operationalize that into the National Plan of Action on Aging. And in the National Plan of Action on Aging, which we imputed in the National Development Plan, that operationalization was how do we create a geriatric social care quality assurance system? Because before you can move informal caregivers into the formal market, before you can unlock that market for women and girls who are majority of the people who give care, then we must build the systems. And so what we did in the National Senior Citizen Center was that over 3 years, we built that system. And so we ensured that we worked with NBTE. Of course, we mapped all the relevant stakeholders, and NBTE was top, and Federal Ministry of Health, Nursing and Midwifery Council, Gerontology Association of Nigeria, Gerontology Association of Nigeria, Social Work Association, Geriatric Social Work, Medical, all of them, up to Alzheimer's Association of Nigeria, to agree that there is a gap in the industry, to agree that there is need to standardize. People cannot just be training from different curriculum. So we worked with NBTE. Care was admitted into the Nigerian Skills Qualification Framework as a skill. And being a skill now, it means now that you must develop the National Occupational Standards. There has to be a standard training manual. And so that we did with all the stakeholders. And of course, NBTE had to approve. Following from there, we had to identify who's going to be the training providers. And so we identified training providers. First, we wanted the institutions who have geriatrics units. So we identified the teaching hospitals that have geriatric units. And of course, yes, they are professors, they are consultants, and so on. But because they are going to train as a skill, they must have their quality assurance assessor certification. And then having done that, they must be accredited. And then you set up the Geriatric Social Care Council, the Skills Council. Who are the ones to know what the industry needs and to match the training with the need of the industry? So I'm saying this to say that it's a whole geriatric social care quality assurance system. And so we have walked through that system. And I'm very happy to tell you that as we sit here, some institutions have been accredited for the first time in Nigeria to train and certify caregivers, the NSQ certification that you find abroad. In fact, I should mention the University of Benin Teaching Hospital. As I'm sitting here now, the certificates have already been signed, and it's going to be a big ceremony. So Nigeria has unlocked the geriatric social care space. So our women and girls who were invisible, who were not recognized, who were not classified, now they can enter the geriatric social care market as certified professionals. And I want to say that the level is from level, we were able to, to develop from level 1 to 5. And they have their titles. They will have their certificates. And NBTE worked with us, and they have been integrated into the federal government employment scheme. So you can imagine that. And how did we now, to ensure that these centers of training are spread across the country? We now started talking to the governors that, look, you have a university teaching hospital here who has been accredited. I was in Akwa Ibom shortly before I left. I finished my 4-year term at the National Senior Student Center. You have a training center here, and then you're building a geriatric center. Good. So now you have where you can train and certify your indigents. And then not only that, I say, Your Excellency, now you have 70% of your older persons in the rural area. Most of them will not be able to come to your center. So what we have done is that we have developed the geriatric social care community extension services. So these trained and certified caregivers can work to go to the community, can be aligned with the primary health care center that you have. And then apart from that, we also worked with the private operators of care settings. So we had the people who operate residential care facilities, respite care homes, senior centers, and all that. So we also brought them in. We brought all of them in and started building their capacity to understand the national skills qualification framework, that they need to be accredited. Along this line, of course, we had developed the first ever national policy on geriatric social care quality assurance and the standard operating procedures. We had developed the national benchmark and minimum standards for accrediting care settings and training centers. We had also developed, like I said before, the national occupational standards. And then we had also built a national central portal so that we can now have all the certified caregivers, or the accredited training providers, all the actors in this area, just one stop. You click. You can know which caregiver is certified as living near your parents, and so on and so forth. So this is what we had been able to do to unlock the geriatric social space. So my prayer is that this continues. And as I was talking to her, I said, Nigeria really needs to pursue what you're saying. Instead of having the child care in silos, you have the geriatric social silos. And of course, you have special needs care. A lot of people have come down with neurological conditions. You have people suffering from epilepsy. You have those ones that have Parkinson's disease. You have those ones that have all manners of cognitive impairments. Vision impairment is spreading, especially amongst the geriatric geriatric sector. So many different kinds of, different population cohorts needing care. So Nigeria really needs to have an umbrella policy, and I think Nigeria needs a care commission where the regulations will be brought in for certification, for inspections, regulations, and so that we can really meet the, global standard practice. Thank you.
We can do better. How many of you have heard of these systems before you enter this place? I have heard of National Geriatric System before. Let me see. You see? Please, let's appreciate her. It shows that a lot of work is being done to ensure that care work is being recognized and professionalized. Because imagine if you find someone who is a caregiver and abuses an elderly, that person's license will be revoked, and that means that he or she would not be able to do that to somebody else, and it means that there is accountability in the system. So let's appreciate them for the work that is being done. Okay, so we have one of our speakers online, Ada Osemede from IFC. She'll be joining us online, but my next question would be to Dr. Runo before we go to Ada. So for ILO, we know that ILO is the International Labour Organization. So we want to know decent work within the care economy, particularly for domestic and care workers, remains a global priority. Hence the reason why a lot of Nigerians are jackbuying. Good. So what lessons and international labour standards can Nigeria adopt to protect care workers, their rights, and ensure fair wages and professionalism within the sector while expanding care services?
Thank you very much. I'm really delighted to be here, and I really want to commend our government counterparts, because we can see that Nigeria has been making significant effort towards strengthening the care infrastructure in Nigeria. And I think we had the data from you at the beginning, but just to also highlight some of ILO's work around this. First of all, unpaid care work and domestic work account for over 76% of all unpaid work, and of course, this is global data, but 3/4 of these, of course, are women. And also, another ILO report estimated that over 9% of global GDP, if we looked at the unpaid care work, particularly looking at the minimum hourly rates for unpaid care work, it will account for about 9% of global GDP. And just to put that in context, that's about $11 trillion in when you look at purchasing power parity. So it is a very significant issue, and I think we really need to commend the ministry here from National Planning when they said that they now have unpaid care in their budget, because that's a big first step. ILO, of course, some of you don't know, but ILO is a UN organization, is a standard-setting organization looking at work in labor, ensuring adequate working conditions and rights for all workers. And as part of that process, the ILO develops international standards, which are called conventions. And one of the conventions that is relevant to care work is the Convention on Domestic Work, which is Convention 159. And basically, it highlights and articulates the standards for fair wages, the standards for the best working conditions, including looking at limited working hours. It also highlights the importance of having access to health insurance. How many of your domestic workers have access to health insurance? And having those sort of protections. So it is usually, I don't know if the Ministry of Labor was part of this engagement, but usually we encourage countries to ratify those conventions, because when those conventions are ratified, they are then integrated into the national labor laws. And of course, when you have that in the national labor laws, I think that's the first step to recognizing that unpaid care work is an essential infrastructure, just the way you have road infrastructure, energy infrastructure. Unpaid care work is that significant. So that's the first step. The ILO also has what we call the 5-hour framework. And the 5-hour framework really looks at the importance of first recognizing the issue, which is what we have talked about. For example, I give the example of Mali, where they had a national survey to just sort of look at what this issue is really about. And they found that unpaid care work was contributing about 17.6% to their national GDP, and that discovery alone led to policy innovations, investment in gender responsive public policies, such as childcare, community-based childcare. Also looking at the amount of time women spent on things like fetching water in the rural areas, so they had water infrastructure. So that's the first step, which is recognizing the issue. The next step is around reducing the burden of care, which is part of what I talked about in terms of looking at the cycle of care. And it's not just child care, it's elderly care, which is long-term care, it's healthcare services, it's having access to social protection, as I mentioned. And then the next thing now becomes, how do we redistribute this care so that women do not bear the burden alone? So this is all part of the 5-hour framework. And Senegal had a pilot study on this as well, where they looked at workplace family-friendly policies in the tea plantation sector. And they discovered that just by having programs that cater to on-site childcare facilities, they saw a reduction in absenteeism from workers, they saw increased morale and productivity. So I think it's really critical that, one, we begin to measure and track and create the data, and I'm sure the Nigerian Bureau of Statistics is here to tell us some of the critical things that are involved and that are necessary, and I'm sure we'll get more data on the critical importance of time use survey as well. Another thing that is also critically important is to have worker representation, right? As the ILO, we know the importance of collective bargaining. When people are formalized within a group, they have a collective voice to call on government to change policies and to make the difference using best practices all over the world. So the ILO encourages worker representation, but you cannot do that if you don't even have a professional care formalized sector, and this is what she was talking about as well. So one of the key steps also is to look at how do we look at the trainings, the accreditation process. If you look at a country like Philippines, care work is one of their biggest exports. They have formal trainings that also where workers go through the set of process, get accredited, and the ripple effect is that you have an elevated status of care workers, you have better remuneration for them as well. So this is something that is also critically important. And just to talk about lessons from across the world, including in Africa, I'll start with Africa, where UN Women and ILO supported community-based childcare community-based childcare service, and because of the monitoring that was done and the impact, it was scaled to national level program, and you had both government buy-in and donor buy-in as well. So again, some of all these interesting things you're doing, I think they say we should learn to show our work, give your work visibility. So especially in this day where distribution of data and with the social media platform is very easy to document and demonstrate the impact of your work. So I think that's critically important. You also have Rwanda as well, where they've had similar programs, and Senegal. So I think that there are many countries with good practices. In South America, I think they have one of the most comprehensive care program because it addresses both child care, elderly care, people with disabilities, which she talked about, but it also includes the professional formalization of the domestic care sector. Thank you.
Very much for that response. Indeed, we need to be able to adopt some of these practices that is already existent. That way, we'll be able to understand and make corrections as it suits our own context. So that's a very insightful contribution. While we still have Ada online, my next question will go to Madam Caroline from the Nigeria Bureau of Statistics. Now, using the ongoing time survey, which is a landmark in generating data, right, and unpaid care work, how can this survey help influence Nigerians' care policy and guide investment in the care industry at the national and state levels?
Thank you. Let me correct one impression. NBS is National Bureau of Statistics and not Nigerian Bureau of Statistics. That's one. Thank you. I find out virtually everybody is saying that. But NBS is National Bureau of Statistics. Now let me go back to the question of time use survey. Just as you rightly mentioned, thank you. Time use survey is indeed landmark efforts, because it's the first time that National Bureau of Statistics uses the framework of ICATUS, ICATUS 2016. ICATUS means International Classification Activities for Time Use Statistics. So we use it to measure how Nigerians spend their time across productive, which is called SNA, non-SNA. So how they spend this time across productive, non-productive, unpaid domestic and care work activities. So it was, just as we've been mentioning, it is disaggregated by sex, by age, area of residence. What do I mean by area of residence? I mean it is classified urban or rural. So, and it also follows suit the indicator of SDG 5.4.1, which make countries to be able to align to measure proportion of time spent on unpaid domestic and care work. I will go back to your question once again, because the question said that how it is nationally, the benefit, the findings can be benefits to the nation and as well as to the states. I think to categorically say that the time use survey carried out by National Bureau of Statistics is not nationally represented presently. It's also not geopolitically represented, because Nigeria has 6 geopolitical zones. So I need to make this one clear. So it was only conducted in 4 states, and the 4 states is in Lagos, in Kaduna, in Borno, as well as in Cross River. These are the 4 states that it was carried out. And I also want to mention that it's still work in progress. The result is not out yet. Stakeholders are yet to validate this. So I will talk in a little preview of this survey. But be as it may, even having said that, how can the findings be useful? Let me try to explain. That will not stop me from explaining, even though the result is not out. Number one, if the result comes out, what can it help us to achieve? It can help us to achieve the policymaker to recognize the unpaid work in policy, so that the policymaker can be able to see maybe they need to integrate and see how does unpaid care work, how does it contribute, what is the contribution to the economy and to social well-being. And then so that we can be able to, rather than looking at domestic activities as invisible, rather than seeing it as invisible, government can be able to say, or the policymaker can be able to see how they can be able to integrate this. Another way that it can also be useful is to be able to see investments that care services can be able to do. If you look at an investment, then this, with the data, will be able to reveal to us when the data comes out. It will show us trends. It will highlight the trend in which time is being spent, so that through it we can be able to see how time is spent on child care, how time is spent, water collection, the time that is being spent, household maintenance, food preparation. So by the time this trend, and you see how this time is being spent, it will help the survey states. What do I mean by survey state? I mean the states, these 4 states where the survey is being carried out before the national, because National Bureau of Statistics is also still looking at carrying out a national survey on this, so that everybody can be able to see what belongs to them. So the survey state can be able to prioritize. Let us look at water infrastructure. We look at community care services. We look at energy, access to energy. We looking at water infrastructure. So this will help the state to be able to know and see what to prioritize or what to investments they can be able to do. Another way I can say this one can also be able to help, the data can help it will also support this gender responsive budgeting. Are we going to integrate budget into budget tagging or policy planning that can be able to ameliorate women time burden, or that we can be so that we can be able to do redistribute the care work. We can be able to redistribute it across board, across maybe both the gender, the male, and also be able to share this one and redistribute it. Another way that the data can also be useful is to be able to see it to inform labor and also social protection policies, so that through social protection policies we can be able to see, is it gender focused when you create that? Can we be able to make sure flexibility in the work that we are doing? Are we looking about remote work? Are we looking at paternity? When you are giving paternity to men, are you giving, because if there's no money, the men will tend to go back to work, so that you cannot be able to allocate this work. And also another way that this can also help, it can also help by the time the National Bureau of Statistics carry out the national survey, This will also help us to be able to see, to benchmark best practices. How? We can be able to integrate satellite accounts. We have satellite account for other things, but we don't have satellite account for unpaid datas, unpaid care work datas. So we can be able to incorporate or integrate national satellite accounts in the SNA. What do I mean by SNA? That is System of National Accounts, that can help the nation to be able to account and be able to work according to what national budget and planning have really talked about. So,
we want to give her at least a few minutes to answer her question, because we've been asked to wrap up. We're already behind time. Thank you so much, ma'am, for the contributions. We really appreciate you. So just to wrap up this session, I would throw my last question to Ada. Ada is the Senior Gender Advisor of the International Finance Corporation. And Ada, can you hear us, please? Awesome. So would like to know, from the private sector perspective, which is very critical in expanding childcare and elder care services, what are innovative investments or models or partnership that can attract private capital in the care economy in Nigeria, and how can we build the business case for it to scale?
Thank you very much for that question. It's been a really insightful conversation, and I'm grateful to everyone on the panel for their contribution so far. But just to say that now I have the burden of being the last speaker, so you bear with me as I address this question. And I really would like to commend, the budget and the Ministry of Budget and Economic Planning, MBS, Dr. Omokaru's work, ILO, because what it does is strengthens the enabling environment for the private sector to thrive and to invest in the care economy. So when we say private sector investment being critical to expanding childcare and elder care services, I think just to put context around it, I would like to frame who the multiple actors here could be. So we're looking at employers, we're looking at employers of labor, we're looking at investors and financial institutions, we're looking at the care entrepreneurs themselves, and of course the enabling environment. Who is strengthening the enabling environment to ensure that there's the policy tailwinds to push all of what is being what is being built and developed. So when you look at the thought of the national care economy policy, that was really music to my ears, and I'm so grateful that it was shared, on this platform. So back to your question now, I haven't framed it. Thinking about innovative investment models or partnerships that can attract private capital into Nigeria's care economy is really looking at how do you support the multiple actors that I've talked about to pull in funds into the private sector, into the care economy, So if you look at the supply side, and I'll speak through three lenses: the supply side, the demand side, and then the enabling environment. If you look at the supply side, we're talking about the employers themselves supporting employees and also supporting care enterprises, right? You're also looking at financial institutions and investors. So on the supply side, when we're talking about employers, one of the things that IFC is doing, and we see that that's been replicated and has had successes in other markets, is working with employers to expand the availability of family-friendly policies in Nigeria's private sector. Because by doing that, what you're getting the employers to do is to invest in employer-supported childcare. So either through policies, through shared costs for care. So there's several examples like multi-employer childcare hubs, employer cost-sharing vouchers, to support employers to support their employees to access quality childcare. Because in these parts of the world, when you think about quality, affordable childcare, it sounds like those two words shouldn't go in the same sentence. Where you're looking for quality childcare, then it's mostly unaffordable. But what we're doing is to help the employers to understand the business case, the benefits to them, and then also build their capacity to invest in employer-supported childcare, so that it not only becomes a competitive advantage for them as employers, it also helps them to strengthen their bottom line. And by generating evidence around this topic, it helps them to see the benefits, and it helps them to invest in employer-supported childcare. Then you look at the financial institutions and investors, and for them, what we have realized is that care is a very new category of consideration, very new market for investors and capital allocators. So what we are doing is to work with the private sector investors and financial institutions to understand the care economy. We've started with what is most obvious, the child care end of the care economy, and of course we are introducing the elder care end of the care economy, helping them to understand the viability of this sector, and then also building their capacity to adapt or design solutions for the care economy. So we've been talking to FIs, to financial institutions and investors. We've had several consultations with them. We're helping them explore models such as blended finance, result-based finance mechanisms like impact bonds, or even social success notes that can be leveraged from investors to support service providers in this space. There are also other models like the pay for success contracts, grants, loans, challenge funds, awards and prizes that help to surface existing solutions in the market and support the promoters of these solutions and ideas, so that it helps to scale innovation and its implementation.
All right, Ada, please.
So these are some, yes, please.
So sorry, can you just help us wrap up, because they're already bickering that we are far behind time. So you just wrap up in a few minutes. I am so sorry for interjecting.
No, it's fine. It's fine.
Thank you very much.
That's what we're doing on the supply side, and I think that's mostly what I wanted to talk about. Of course, on the demand side, where you look at the care entrepreneurs themselves, one of the things that should be done, and we're doing as the IFC, of course in partnership with UN Women and other partners, is to build the investment and loan readiness capacity of the care entrepreneurs themselves. First of all, identify who they are, increase their awareness for business management skills, and strengthen their capacity to scale their businesses, because it's mostly fragmented right now in Nigeria. So bringing them together and helping them see the opportunities in that sector, then helping them to scale. But just riding off the back of what Dr. Omokaro shared, it was really exciting to hear the National Occupational Standard being set up for elder care. We're doing the same thing for childcare, and I would like to connect with Dr. Makaro after this. So we recently worked with the MBTE as well, and the Ministry of Education, to set up the National Occupational Standard for childcare, and this is now being rolled out. We've started trainings with the for quality assurance assessors, and we're doing this, of course, ISC is part of the World Bank Group, so we're doing this with our colleagues on the IBRD side, and the idea is really to professionalize and standardize this sector so that it helps to elevate the quality of childcare provision in Nigeria. I'll pause there for now in the interest of time. Thank you.
Thank you very much to our speakers. Thank you so much, Mrs. Grace Obi from the Ministry of Budget and Economy Planning. Please, as I called your name, please appreciate them. Thank you, Ada Osamede from IFC. Thank you, Dr.
Sorry,
Rino.
I am Osademe Udechiku. Thank you.
Osademe.
I meant to correct you on that.
Thank you very much for correcting me on that. Thank you, Dr. Runo. Thank you, Dr. MM. And thank you so much, Mrs. Caroline Fatoti. Did I get the name correct? Thank you. All right, so you will all agree with me that this conversation has been nothing short of insightful, and we have covered the main reason why we're here. We've looked at areas that would Sorry about that. We looked at areas that would recognize through the systems that has been built, look at areas that will reduce, and we also look at areas that will redistribute the need for unpaid care work. And I love the fact that we went from systems to other systems, to community of practices, to tools that will ensure that we recognize where this redistribution would take place, and also, most importantly, the need for private investments. So I believe that our question, how do we ease this burden, has been answered, hasn't it? Has it been answered? Now it is left for us to go back to do the work that we have started. I am so sorry we could not give you time to ask question. 2 minutes. Oh, thank you very much. Two questions. Okay, 1 and 2. Let's make it gender balance. So yes, you can take it. I'm so sorry. She was the one that raised her hand first. So sorry. Yes, we can.
All right, good afternoon, everyone. My name is Olaomi. I work as a gender lead in Oxfam. I think I'm most excited because of the work and everything I've heard today. However, I just wanted to actually, I'm turning this to the ministry for us to have a kind of sense of synergy, because currently the Ministry of Labour is working on the gender workplace policy, which is cross-cutting, so that we're not working in silos and duplicating effort. It's important that we also check in with them. I see the need for the care policy and also to synergize with the workplace gender policy. Thank you.
In Nigeria, mortgage data consistently shows that women face greater barriers to accessing housing finance compared to men. At a time when gender inclusion is at the center of national conversations, why do women still struggle with affordability and ownership when it comes to housing? What structural or policy gaps need to be addressed to ensure women can access mortgages and own homes on equal terms? That's my question. To everybody, it's just a general question. It's just a general question. It's on mortgaging and house ownership, and right. I feel like mostly in Nigeria, it's just men. I say who owns the house? It's always a man, and it's scarcely to find
all right,
women.
Thank you. We'll just add one. Can we add 2 more questions? 2 more. Okay.
Thank you. Okay, so good day, everyone. My name is Chima Okoli. I'm a gender specialist. And the very important question I want to ask about this unpaid, there's a very interesting dynamic that we have here in Nigeria as regards unpaid care work. It's the fact that there's this lacuna between finishing SSC and getting into the university. And if we look at our family makeup, you'll find out that a lot of the people that give this care work here in Nigeria, since the men and the women usually is now a 2-worker household, this particular demography are very responsible for a lot of the unpaid care work. How can we ensure that we look critically into it and kind of get them into these plans that we are having at a national level? Thank you.
Yes. Who are you directing your question to? Or anybody? All right. One more question from this angle. Do anybody have any question here? So we have questions from all the 3 rows. No question? Okay, somebody was raising. Okay, let's go then. Our final question, yes.
Good afternoon, everyone. Thank you so much, Mars, for the insight so far. Okay, so my question is actually a general question, but I'll be addressing to the madam in the middle. with the beautiful hair, and the pearl. I didn't get your name, I came in quite late. So, I like the fact that we're really dealing on this whole care worker thing. But I know that the Nigerian setting, a lot of this whole care worker thing comes from family to family. How do we handle this and ensure that we're not destroying the family setting? The bonding thing we have in Nigeria. How do we ensure that, how I have my sister, I have a niece, I have a cousin who can come stay with me. How do we ensure that in doing this, we do not destroy the Nigerian family setting that we have?
No, from her. Did you get hers? Okay, so we'll start with you.
Thank you. Truth is that, let me start with the question. The government of Nigeria is one, there's no two government. Even in that, there are leads and there are implementers. So the Ministry of Labor has the mandate to do a specific policy that has to do with the one you talked about. The care policy is cross-cutting. It's not addressing those in labor, it's addressing those that are outside labor. If you were here when I spoke, I said, we are not trying to do the care policy to monetize care work. We're rather trying to do the care policy to take care of those that are not paid, but they deserve some life of dignity. So when we plan for Nigeria, the tendency is for us to plan for things that we think gives us economic benefits. Oh, we create roads. It's going to take us to the farm. We do roads, but we don't look at things that are not tangibly looked at in economic factors, but they are important for economy. So the care policy is going to be telling government, if I'm sitting at home to take care of the elderly, I should be able to have some protections, even if I'm not being paid. If I have domestic accident as a caregiver, I should have some protections. If I have my own children and I'm looking after the elderly and uncle and auntie, I should have some protections. We have social protection policy, which we're already working on. Yesterday, I spoke about the gender responsive budgeting and planning framework. Those are things that also take care of it. So the policy is not different. Labor is specifying on the labor part of it. Her agency is specifying on the elderly. The Women Affairs will be specifying on the child, but they draw from the broader care policy framework. My brother that talks about housing is beyond this circle, so it's going to be addressed in the social protection policy. Housing is there. It's beyond here. And as the closing remark, I want to say that yesterday the country director of UN Women said Nigeria has the potential of providing 11 million jobs from the care economy. Said these are proven, data proven, evidence proven. What it means is that our youth has potential of creating that economy. I want to digress a bit in 1 second to say before now, if you are into digital economy, you are Yahoo, you are a fraud, you are arrested. Last month, the president passed the new tax reform. In that tax reform, digital economy, digital business, fintech is now recognized. No more Yahoo. But so it is now recognized. Before now, laptop is Yahoo. So we will get to that, but we start the narrative by doing this. And the other side of it is that you begin to pay tax. The years of doing services without paying tax might be over by the time we are done with the policy. So we look at it at balance, but it's going to be a win-win. We export now professionally well-tracked caregivers. Yesterday news that the Bikedabe was talking about the lady that was deployed. That will not be the case by the time we have this policy. Professionally tracked, well paid abroad. Exploitation will be taken out of the context. Thank you very much.
I should answer I think I'm really excited about the questions. In fact, the two questions. So I'll take yours first. How will this strengthen or weaken families? As a matter of fact, the intention is to strengthen families. You were not here, had earlier talked about the dilemma that family members are facing, the conflicting roles, and the fact that that African model of children are the children who can no longer holds. So now we mapped, there are different kinds of care settings in Nigeria. And one of the most popular setting is aging at home. That's the domiciliary care. Domiciliary means taking the care to where the older person is. So we accredit, train, enhance their capacity, and give them grants. That's what I wanted to do this year. Give them grants to upskill and upgrade to the standard that is in the benchmark, the national minimum standard, the benchmark and minimum standards. And then these caregivers that we have certified and trained can work in these domiciliary care agencies and be sent home. So the older person, the adult children, instead of being strained and spent out and burdened with care and then taking it out and abusing the older person, you can just place a call to the domiciliary care agency. And they send you, first and foremost, depending on the degree of care that you want, the vulnerability and the need, they stay with you and develop a care plan. And then they come there to execute the care plan. And then you can stay as family member and you have a supervisory role. And because they are accredited and licensed, then you can report. And nobody can fool around with an older person. So that is it. But I thought the question would be who pays? We'll come to that next summit. And so your question was, now you identified a population cohort, that category of the youth who maybe they are out of school, they want to get into the university, and they are there. They are the ones actually taking care. So have they been counted in this care quality assurance system that we are building? The answer is yes. Because the National Occupational Standard recognizes the basic level 1 to 5, and then the OND, and then you can go on to the HND, and you become a true, real, high-class professional. But at this basic level, SSC is admitted. So long as you can read and write, and you have your basic secondary school certification. That's the level 1. So they are certified. And then there's progression. Progress to level 2, progress to level 3. Before you know, you become a geriatric social care officer with your badge and your this thing. So everybody is taken care of. Even pro-learning experience, we talked about it. A grandmother who can read and write, who has been taking care for long, an older person yourself, like a retired nurse. You can go in with pro-learning experience, and then you are evaluated, and then you have a level that you start, and you are certified. So everybody is covered, everybody is taken care of, and the family will be strengthened. So that is the question.
Thank you very much for that response. I think on this note, we can call it a day, right? Thank you so much. Please, yes, to take a picture.